might have done something wrong here. Can you see? Okay, good. Okay, good. Okay, so here we are. This way, yeah. Okay. Oh, do you think I have it upside down? I think I do.
Yes.
Yes. Okay. 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 So we're looking at perpetuating factors, and one thing that we're looking at is we're looking at paradoxical breathing. Another thing is we're looking at just the seated position. See that we're in the seated position, and we put the thoracic lumbar support here, and his head's coming back pretty good there. Hi, who's joining us there? Hey. Okay, so and then we always like to put everyone's keyboard on their lap, and then we have them look at their screen at about eye level, or a little bit lower is fine as well. So this would be the best way. And he's decided not to sit at all, right? You were saying?
Yeah.
He hasn't been sitting at all because the pain of sitting is too horrible. He doesn't sit, and he just uses would you say that you did instead? Voice. He just uses voice. Yeah, no.
Siri.
Yeah.
It types everything in for me.
He does it everything. It works for him. Yeah, but we also would like to be able to sit if you wanted to. Yeah. Okay, so let's review the breathing. Can you hold this here? Okay, so when you're seated and on your tummy, and one hand on your chest, like one hand here, and then like maybe right on your neck, and then you want to do is inhale, tummy goes out. Exhale, tummy goes in. And not lift up the shoulders. So notice, okay, inhale, tummy goes out. Good. You could do it immediately. And exhale. Inhale, tummy goes out. Okay, so you definitely could do it. So no question about it. So let's
I was in yoga.
He's done yoga before.
Oh man, that's shameful.
So what you want to do is not lift up your shoulders, and learn to like just do it standing, seated, laying down when you're, everything with.
I just need some practice.
You could do it with just practice. Yes,
Yeah.
I think I've had many people learn to do it only a few weeks, and others took longer. But even someone could learn it in as little as only a short
Okay,
time.
if that's gonna decrease the pain, I'm gonna do
Totally.
whatever.
He will. If it's going to decrease the pain, he will do it. Okay, let's do it standing. Let's try it standing. Okay, so. Oh, and by the way, he did have his ischial lift and his back support there.
Yes.
Yeah. Okay, so so go ahead and stand up and do it. So go ahead and so one hand there, and inhale, tummy goes out. And see if you could not lift the shoulders. So keep and inhale, tummy goes out. Yeah.
Part one of the three-part breath.
Right. And inhale, tummy goes out. Yep. Good.
Do you remember what that's called in yoga?
In yoga,
Tony,
what do we
the
call
three-part
the
breath?
So then we would go up, and we would also go up and expand the upper chest as well.
Yeah.
But in this case, that's not what we love that.
Yeah.
But
We
that's
used to
not
do it faster. It was like something like this.
okay. So that's
With
one
the
of
tummy.
Yeah.
That's the
Yeah.
breathing exercise.
yeah. So sometimes that actually activates. I had one person that we fixed, and then they did that kind of breathing, and then it caused them to get all activated again. It was very disappointing. Yeah. Okay, so you're just gonna practice. So and not lifting up here.
Yep.
Yeah. So it's just so he's gonna learn to just check that a few times.
What else might cause someone to breathe through their chest instead of?
Okay, so let's look at it. Let's turn this way. So one reason would be their abdominal muscles are tight.
Weak.
Okay, so right here. Yeah. So I would say, so what happens is the abdominal muscles are pulling the chest this way, and then when you inhale, the tummy muscles don't want to go out. Okay, so that's a little painful, right?
Yeah.
Yeah, it was kind of painful. So the abdominals are pulling you probably forward like this. Yeah, so they learn to be short. So we have to get them, so what if they learn to be long? Then you'd be like effortlessly standing and effortlessly seated. So these here, we have to get them to be just a little longer.
Okay,
Yeah.
what's another reason? Another reason why someone might learn to be a chest breather instead of a abdominal breather.
Because they're holding their tummy in.
They want to look good.
They want to look really nice and thin.
Yes.
So like everyone try it. So if you hold your tummy in,
Small
like this,
tummy, big chest.
so we're holding our tummy in.
That's
we
how
have to-
all good people look. Good-looking people,
Like
they'll look like that.
Mr. America, right?
Yeah.
You gotta get your chest out there and get your tummy way in like that. But then that causes you to not be able to causes a lot of pain in the neck and shoulders. Yeah.
Great, great.
Yeah,
Okay, how about one last reason? Why would somebody breathe shallow and in their chest?
Instead of using their abdominals.
Yeah, instead of a nice, a more relaxed.
So why would they do it?
abdominal
Because they
breath.
smoke.
Maybe smoking, yeah.
Because they smoke, and there's a tendency to do that when you're a smoker. So when you're a
Exactly.
smoker, you tend to use these muscles here.
To draw that in, yep.
You could draw in here.
Someone said beer gut. There, if you have a lot of swelling in your abdomen, you may learn to be a chest breather because you've got such a swollen gut. And what about just anxiety?
Well, a lot of the beer gut has a lot to do with the muscle isn't working anymore. So then, if it's not working, it's hard to make it do its job.
Well, yes. Plus, people run out of space in the abdomen
Yes,
to
can't
expand
inhale.
into. Yeah, yeah. And it's right. So anxiety, asthma, these are all big important factors. But if you aren't, if you know someone has a lot of anxiety and you don't deal with anxiety, then you might want to suggest they see someone about anxiety. And then the combination of you working on breathing, that's like a physical way to treat anxiety, and them working with anxiety, which is an emotional way to treat the neck, then you can work together real well. So that's...
So some of the
Important.
muscles that we want to look at is short abdominals, and another one is short pecs.
Okay.
So let's check to see if you've got short pecs here.
Okay, great.
So we're going to listen to, go ahead and listen to your watch and take your arm back, and so you can feel a little bit of tension right here, so the pec's a little tight there. Let's look at the pec major, and you can see, right here, pec major. So right here, you can see.
How far should it be able to go?
You should be, I can feel the dysfunction, so you can feel that it's not.
So it's an
right
end
there.
range feel?
Yeah, end range feel right there. And here I found some little noises in the shoulder. Okay, so here we want the pec, the middle pec to, the upper pec is tight right here. I can feel it doesn't want to come back. And there too. And let's listen to let's do the pec minor. So listen to your watch, like here. Take your arm back. Oh, this one doesn't want to go back, see? So it's like a feel, you can see it doesn't want to go back. So the pecs and the abdominals are pulling you forward, causing a little trouble.
There you go. There you go.
So this would be part of what's causing trouble here, is because if these are pulling you forward, then these have to constantly work, to
keep me back.
keep. Oh, you gotta keep, get there. So let's check. Another thing would be not having the minimum strength. So
Minimum
today-
strength?
Mm-hmm. So we're gonna check for the minimum strength for the posture muscles as well. So we're gonna do that as well. So we're gonna check that. So minimum strength. So let's see if we can find some really strong muscles. So let's go ahead. Let's go ahead and do the Krauss-Weber minimum fitness test. So let's have you go ahead and lay on your back.
What subject are we covering right now?
We're just checking the strength of the posture muscles.
So an underlying
minimums-
perpetuating factor.
Would be not having
deconditioning?
minimum strength of the posture muscles.
Yeah. Okay. So there's a Krauss-Weber test that is that tests for some minimum
Strength and flexibility.
Yes, minimum conditioning. For you to, without this minimum strength, flexibility, and strength test, if you don't pass them, then that deconditioning is a perpetuating factor that keeps pain coming back.
Yes, and our teacher, Bonnie Pruden, made the point that all of us my age and younger, all of us, most of you out in the viewing audience, don't have the strength that you need for your posture or your flexibility.
So
we'll
may
check
I
it.
have that sheet?
You may have.
Or let's see which is this one here. Yeah.
Okay.
So
Hold that. You want
yeah, I want to document here again. See on this date.
So for this, we're gonna have you do.
Can you wait, sweetheart? Hold on.
I'll wait. Okay, I'm gonna wait.
Okay. So right here, and we did the Krauss-Weber. That's K
Hold your feet. And then
W
have you come up into
Krauss-Weber test, and it's 531.
Yeah, you
And results we'll find out. There are 6 tests he has to pass. Okay.
No, we do that for 6 o'clock.
Okay.
Okay.
Yes, we do it first.
Okay.
Sharon, is
Okay.
it 6 tests he has to pass? Is that what it is?
Yes,
Is it 6?
Yeah. So we're gonna see if you can pass the 6-pack test here. So
Okay.
let's go ahead and come up like an airplane. Put your hands like your elbows come on up. And he passes. Okay. So the next test we're gonna test
Okay,
is
what's that one? He has to be
that
able
was
to
the
do that.
abdominals.
Okay.
That was for the abdominals. This is for the abdominals and the psoas.
Okay.
Okay. So same thing. Come
I
on up.
got this too.
He always does this. Oh, he does this when he's passing with flying colors there.
Okay, no problems there.
Okay, so now we're going to test the psoas by itself. Okay.
Size by itself.
So here you're going to keep your back flat. So put one hand underneath here so you can feel your low back. So feel your back flat against the table. Okay, and you're going to, I'll hold your legs up for a second. Let me hold them up. Okay, now you're going to hold them up for a count of, let your head rest. Hold your legs up for a count of 10, but keep your back flat.
Okay.
1, 1,000, 2, 1,000, 3, 1,000, 4, 5, 6, 7, 8, 9, and 10, and relax. How did that feel? Was it okay?
Lower abs.
Was it a little hard, that one? But you did it.
Yeah, lower abs.
Yes, lower abs, that was good. He did it,
Passed
he
it.
did it. Okay,
Good.
go lay on your tummy. Oh, he's passing these, he's gonna pass everything.
So
He's passing it all.
deconditioning so far hasn't shown up as
No,
perpetuating
he's having no
factor.
trouble with that. Okay, I'm gonna put a little weight here, now lift your upper torso up, lift up, up.
So what he's gonna do-
1, oh, that's a little hard. 2, 3, 4, 5, 6, 7, 8, 9, and 10. You could do it, but you didn't lift very high. So this would be these
Yeah,
muscles.
that's because of the pain.
That's it. So for this one, we want to get a little bit. So the upper
Okay,
back.
so we would
okay?
say, what was that? It
So
was
we're gonna let your head
4.
rest.
Test number
Rest.
4.
Yeah, sorry. Okay.
Didn't pass test number 4.
And let's go ahead and lift your legs up towards the ceiling, both legs together, and hold them there. 1, 1,000, 2, 3, 4, 5, 6, and 10, and relax. Okay, good. You pass. And then the last one is you touch your toes. So let's go ahead and have you stand up and
Okay.
see if you can touch
I
your
can't.
toes. Can't touch your toes?
I know it from years, I can't.
Okay, so let's
See
go.
how far
see?
you can go.
So, okay, so minus about a few inches there. So that's almost pass.
Okay.
Almost pass. So a check for also we can check for scoliosis as
So
well.
again, we go
So
here.
Go ahead and let's have you go slowly towards your toes. Go slowly towards your toes. Okay, so here you can see that we have a little bit of a scoliotic. So here you can see that. Okay, come up slowly. So here we got developed over here and over here, and we kind of have a curve coming like this, like that, like we saw
Are
earlier.
you right-handed?
Yeah.
It's considered to be normal to have a little bit of a right-handed curve
Yeah.
if you're
Yeah.
curved to the
Okay,
right.
so
right-handed.
but it was more of a that was significant though when he would bend over. You can see
Oh,
this
show
was,
it- show us
one
that
more
again.
time. Go ahead, lean forward. You see how this here and then here. So this is bigger here and this is bigger here.
Is that
Yeah.
part of the crossweber, or is
Yes,
that?
it is. It's part of the
Okay.
crossweber test. Yeah.
Yeah, okay.
So
That's
we
part
usually
number
check.
6.
Yes, that's what we check for that. So this would be a slight scoliosis. So let's put in the shoe inserts. And let's see what-
Okay, give us a
Great.
second.
Go.
So, Stephanie recorded right here.
So if you
So
could put
Kraus
right
Weber,
here.
sorry for my handwriting again, I'm holding the camera at the same time, but it's so 531
Okay,
passed,
try it
1, 2, 3, and 5, and 4 and 6 didn't pass. Okay? And
Yeah,
obviously you
so
could
it
have
stays
more
the same.
detailed notes,
Mhm,
you know,
yeah.
on anything in your exam forms. But it's nice to have that nice tracking sheet so you can make sure that all the
great.
perpetuating factors have been covered.
Okay, super. So we covered a lot. A lot of underlying perpetuating factors. So we found a lot of interesting things to correct on you, didn't we? Yeah. You're gonna be a new man.
Breathing.
You're gonna be a new man.
So should
So-
we cover just the upper body ones in detail so people can
Yeah.
see exactly how to do them?
Again.
Well, we didn't explain how we were doing them very well.
Oh well, you go ahead. I don't know what you mean. So.
Okay.
Go ahead.
So,
So
for
go ahead.
example, let's
So go ahead. So,
so
a lot
let's-
of the ones that we worked over today,
so small hemipelvis.
the small hemipelvis is really important for the upper body.
Okay, so
Really important. So he had that. So he was short, about 12 millimeters. Then we had posture. So he was with his head forward, and also he had kyphosis. So head forward and kyphosis, and sleep position. He was doing the sideline, but he was kind of in a fetal position, and also like with the pecs all shortened, so that was really a problem. Another thing we found was he has Morton's foot, and that by correcting that, we corrected all kinds of problems. So we corrected the uneven shoulders, uneven hips. We corrected that so that would be really important for upper body and between the shoulder pain. We didn't have short upper arms. That was good. We have a breathing problem that we think we can correct almost right away. So we'll check him on that in a couple weeks to see if we fixed it. And then we have super sensitive spinal segments. We found quite a few of those, so we could definitely correct that as well. And then we found that we just had in the Crossweber minimum fitness test, all we had was the flexibility as a problem.
Okay, so can we explain how to do them now? Like each one explain how to do them, not just the results for him. For example, like we haven't mentioned all the things you should look for when doing posture, and we haven't said how to do the small hemipelvis evaluation, and then what the findings would be, for example, or what the symptoms might be. So to explain how to do each one, so everyone can see how to do it, so they feel like they can do it, because and then what we should exactly look for with breathing and things like that. Do you want me to cover those, or you can? So we'll put this form like for posture, for example. So let's take a look at the form that we have for that. We have a perpetuating factors evaluation form like this. And this is so when you're doing a posture evaluation, you'll do seated and standing. So you can see that we have seated right here. Sorry. And we have standing. And these are the things that you look for. So also you can see that they can be done with shoes on or shoes off. And then of course Sharon showed that they can be done with the lifts for the first metatarsal lift in or out. But so, Sharon, do you want to explain how you go through each one of these?
Okay, so I just choose which ones I want to do, and I only do the ones I want to do, so I don't do all of them necessarily. But all I do, so I look at the ears and I see if they're even.
She looks at
go like
ears,
that,
see if
but
they're
maybe
even.
I don't care about that, so I don't put it in. So then I look here, so I look for all different sections, and I look, is it even? So but mainly what I'm doing is I'm pointing out the most important things that I'm finding. So the things that I found were really important were the different heights of the. So this could be done, but most of the time I don't do any of that because I only like pictures. I don't like any writing.
Sure.
Okay, so here, the head forward, I put yes, you have that. Short upper arms, no, he didn't have that. Leg length, it was corrected. He did have different size hips, but it was corrected by doing the first metatarsal correction. Heel lift, he didn't need one because we did the first metatarsal correction and that corrected that. The small hemipelvis, he did have that, and he needed it on the right side, and he needed 12 millimeters. So that's usually what I do is I write that in.
So you remember how to do that, guys? You
I write
sit
it
the
in
patient
here.
down on a flat, hard surface, and then you look at the heights of those three areas Sharon is showing: the occiput, shoulders, and the top of the ilium right there, and to see if there's any unlevels, leveling, or if there's a scoliosis of any kind. And then you place the lift under one side, see if it corrects it. If it does, but not quite enough, add a little bit more. Or if it makes it worse or doesn't correct it, try the other side. And that'll give you an idea whether one half of the pelvis is smaller than the other. And that's a congenital defect that is there since birth. Some people actually are walking around with one smaller pelvis than the other. So we did find that exactly. Good. Some of these other ones, as Sharon said, we don't do a lot of these. More, we're looking at leveling those three areas: the occiput, the shoulders, and the pelvis.
So you had a little bit of a curve like that.
Yeah. So Sharon makes sure to identify how to level it when in the seated position and in the standing position. Leg length equality, we'll probably go that in more detail next time since that's a lower body perpetuating factor.
Well, it's also upper body, but
Well, they all affect each other.
yeah, thank you. So, no, not that page. Okay, so here it is. Okay, so here was the So this was his. So he was, so I drew it. So when he was higher on one side, then I draw it like this, like that.
Yeah.
And then when he came like this, then I drew it like that. And then you see that he has like a curve like this.
Mm-hmm.
I usually draw that in. Also, here I noticed that his pelvis was tipped quite forward on the one side, but kind of normal on the other side.
Mm-hmm.
And so you just go to the anterior and the posterior iliac crest here into the anterior, and then you measure it there. So,
Perfect.
and then okay, so what next, Justin?
So yeah, so that covers this part that says posture here. So we're looking at one. That's what she does: posture, seated, standing. She makes sure that those three areas are level. And there's even a little thing if you want to draw that. Sleep. So for sleep, Sharon has more in her book on this, but we have a chart of the sleep postures that are good and the sleep postures that are bad, right?
Yep.
And so you would take that handout. Should I make sure that handout gets uploaded then?
That'd be good. That's a nice
Yeah.
handout.
Yeah.
That's a great handout.
Yep, and it shows you the sleep positions that are good and not. And so she asks the patient what is their preferred sleep posture and demonstrate that, and then show them the corrections so that you find something that's agreeable to the patient. Sometimes it's transitioning to the back, sometimes it's just fixing the side lying posture. And Sharon, is it pretty much never the case that stomach sleeping is okay?
Well, not generally, because you're always always shortening one side, and what if you did the exact opposite? I mean, maybe you could make it work, but the likelihood of it working isn't too high.
Okay.
So usually you want to either be back sleeping, or you want to do side sleeping with all kinds of bolsters and things like that.
Yeah, and the idea is not fully extended and not fully flexed, right?
Right, not fully
You
bent.
don't want to like that.
So you want to unbend the joints. So
Unbend
you want to
the
bend
joints.
unbend all the joints, and so you want, but not have them straight, but unbend everything.
Yeah, the knees, the hips, and the shoulders. Okay, good. So sleep, we did. Leg thing, we'll probably cover a little more last time. Morton's, remember, we're going to have a whole class on that, but she did show you how how impactful that one is.
Thank you. Good.
Short upper arms, again, we showed that a couple of times. The elbows should come to the top of the iliac crest. If they don't, then the upper arm is short. And the correction for that, if you got short upper arms, you could find that in probably the big red books over there too.
Well, she might have it
She
in
might
there,
have it.
but usually what we did was we put actually it's not there.
Yeah, okay, it's not there, right?
What you want to do is put a lift underneath each arm, so when they're seated, so that they a pillow or something under each arm, and that would give you a good height for your shoulder. So if you want to go ahead and sit here for a second.
Yeah, let's pretend he had a short upper arm, and we wanted to keep his shoulders relaxed when he's seated.
Right. So go ahead and sit here for a second.
Let me get this from under here.
So if you had short upper arms and your arms were here,
Yep, it would be just
then
like that.
you put a sponge right here or something there, and you put something right here, and you stop it. So then the person who's got the short upper arms, they can't believe it. They go, "Oh my gosh, I can't believe how all the pain went away."
Yeah, otherwise all day, especially with his arms forward as he's typing or using them, there's no place for the elbow to rest, so it's a lot of tension building up in the neck and the shoulders. It can cause some nerve compression, and eventually they start developing some sort of nerve impingement syndromes down the arm. So for short upper arms, if they have it, find a pillow, or especially if they have a chair they use a lot, then Sharon will actually make kind of a homemade permanent
Yeah, so I could
lift.
take some sponges. I bring them with me sometimes to your office.
Yeah.
Then I take some duct tape and I duct tape it, and I put sponges here, and I put sponges here, and I put sponges under your feet, or wherever you need it.
And if his name is Bob, then he gets made fun of a lot in the office.
Yes, that's it.
Sponge Bob.
Yes.
But yeah, so that's it. So for short upper arms, we would put that, yes, we evaluated it, he had it, and you put a 2-inch, sponge lift or something on his arms. Okay, breathing, remember, we saw that one pretty easily. He puts his hand on his chest, he puts his hand on his abdomen, and the abdomen should go out first, maybe exclusively, but definitely first before there's any chest lifting. And if not, then we teach him we just basically teach him to
teach,
stay.
Train everyone to just use the lower area because we don't want them to be lifting the shoulders up. And
Yeah.
you know, when you're singing, it's good to do that. So singing's good training. Sometimes that's a good way to do it. Learn how to sing without tightening up your neck.
Yeah. And we train them in seated, lying, and standing position.
That's right. It'd be good if you could do. So usually what I do is put one hand on the chest, one on the neck, and take 5 minutes and walk, and just practice breathing while you're walking.
Or what if they played the piano and they had a lot of pain during playing the piano?
Yep.
Maybe as soon as they go to play the piano, they forget all about their breathing. So, you know, whatever activity they're having pain in, make sure that they're not breathing paradoxically in that activity. Okay? Someone asked why their arms would be, with short upper arms, they don't get a rest because they're always hanging, whereas the rest of us get to rest our arms.
They say, oh, they're holding their shoulders up all the time. It's just so painful. It's so painful.
It feels like that because their arms never get a rest.
Never get a place to rest.
Never get a place to rest. Okay?
Right.
Good question. And I think that's it. Did we cover another one? I felt like there was another one you threw in there and I didn't. Oh, probably.
Super sensitive spinal
Oh,
segments.
yeah. So you guys know about super sensitive spinal segments. That means that you do the skin rolling, right? We do the skin rolling.
So let's have you stand up again. So wherever we went and we lifted, so we found, so just have the, So here it was, but all was so tight right here.
Yep.
So that means that we have the nerve root is slightly being compressed, and it's expressing it in the skin and the fascia. And so when you come down here to grab the skin, it won't let you to do it.
Yeah.
So there would be all these the nerves that these muscles all the muscles that this nerves go to could be in heightened tone and causing pain and dysfunction.
Yeah. So again, when there's an slight impingement of the spinal nerve roots, one of the first ways that can be detected. Now, I know that also I used to do thermograms or
thermograms,
and electromyographs of the spine too, and that's it. When there was an impingement of the nerve,
and it'd be cool.
There'd be a little cool temperature, or
it could be hot sometimes.
And the EMG would have heightened tone. So it's the little muscles in the skin and the fascia right here, right beneath the skin here, actually get increased tone, and that's why when you go to roll them, it's like you're one of the fanciest, best EMG machines. With your fingers have now become EMG machines, and you've detected increased muscle tone. If only you could stick your hands on the printer and it would print out a sheet. But but the patient can feel it oftentimes too. That area will be tender, right, Sharon? Won't it oftentimes be tender?
So often it will be tender to the touch as well, and it's a little bit tender on you, isn't it? Yeah.
Yep.
Yeah. So he feels it tender right there as well.
And that's an incredible indication that you, as a person with just your hands, are deducing about whole bunches of problems that could come in from the spine having increased tone of the skin.
Well,
like
Dr. Fisher was one of the top physiatrists in the world, teaching other doctors to evaluate supersensitive spinal segments and myofascial pain and dysfunction. He said it was more important than MRIs or X-rays. He said the skin rolling really tells you the information you need to know.
Amazing, yep. And you've seen Sharon corrected before, but in case someone has never seen the class before, Sharon, you go ahead and you treat the